Hello, my name is Natasha Tracy, and this is Breaking Bipolar for HealthyPlace.com. So I want to take a minute today and discuss cognitive distortions. Now, cognitive distortions are basically an example of when your brain lies to you. People with mental illness commonly experience cognitive distortions. Now, recently, someone came onto my blog and they were very distressed, and they said that they couldn't possibly live in a world where everyone was bad. Now, this is actually an example of two cognitive distortions. The first is something we call black and white thinking. And that is where you say that something is entirely bad or something is entirely good, and there's no room for anything in between. So for example, maybe you think your best friend walks on water, and maybe you think that someone you don't like is evil incarnate, right? Either totally white or totally black with nothing in between. But of course, what we know when we think about it is that everyone is really a shade of gray. We all have great characteristics. We all have terrible characteristics. Everyone who's human is just wandering around a muddled mess of grays. That's okay. That's just what we are. But a cognitive distortion would tell you otherwise. And the other cognitive distortion that happens in that line of thinking is something called overgeneralization. So that's when you take one example of something and you generalize it to be true of absolutely everything or everyone. So, for example, when we watch the news and we see all kinds of people who are horrible, or who are murderers, or warmongers, or liars, or cheats, or whatever, we could think to ourselves, well, everyone is like that. And I don't want to live in a world where everyone is like that. But of course, that's a cognitive distortion. That's us taking these small examples that are the minority and generalizing them to suggest that they are everyone, when we know, of course, that's not true. Yes, some people are horrible. I can't deny it. There are some people that I really wouldn't want to hang out with. But there are many people who are wonderful. There are many people who are loving, who are giving, who are caring, who would drop their own needs to help someone else. There are many people out there in this world that are like that. And so instead of this huge generalization that suggests that we're all a certain way, really what we have to remember is, again, we're all different. And we're all good, we're all bad, that's okay. So basically, what you need to do when your brain is thinking an overgeneralization or a black and white thought is you need to combat those thoughts with your own rational mind and say, okay, I understand I'm thinking this way, I understand I'm feeling this way, but I understand that it's a lie that my brain is telling to me because of my mental illness. If you do need help with cognitive distortions, and many people do, it's great if you look up cognitive behavioral therapy, because they will actually help you to isolate cognitive distortions and deal with them more effectively. My name is Natasha Tracy, and this is Breaking Bipolar.